Welcome to my podcast today. So today I'm going to talk to you about two pediatric cases, which is very important as well. So basically, the mother will bring her baby who is obviously not feeding well, or he's in great distress, or he's crying all the time. We know that baby can't talk about themselves, so you'll just notice that they are not feeling well, they are not feeding well, and they are in complete distress. They might look pale, they might be cold, abdomen may be distended. So all of that sort of thing you can distinguish. So basically, after you introduce yourself and double check the patient name, date of birth, and address, you will ask the mother, how can I help you today? What's going on? What's wrong with the baby? So she will tell you that the baby is not feeding well, he's vomiting all the time, he didn't pass the flatus, he's not pooing or weeing, for instance. So I need to explore more in order to get to the bottom of the problem. So, for instance, if the mother says that the baby is vomiting, you could ask, how frequent was that? What's the color of the vomiting? Is it after the feed? What's the amount? If it's associated with food? If it's projectile? And then you will ask if it's associated with blood as well, because all of that will differentiate basically the condition, the underlying problem. And then you will ask if there is any other past medical history, if there is any medication that he's taking on a regular basis since birth. And there is three main questions that you need to ask in any condition of pediatric. So you will ask about the birth, was it normal, vaginal delivery or a cesarean? You will ask about jabs, which is basically vaccines in the UK, if it's up to date. And you need to ask about the Red Book, which is basically about development of the baby, if it's according to the milestone. Also, you'll add to ask about diet, if she's breastfeeding the baby or bottle feed, and what's about the poo and wee, if she notes anything that doesn't seem right. And after that, you will examine the baby, basically. You will check for the physical signs, observation, and then you will examine and expose the tummy to look for anything that doesn't seem right, like, for instance, if it's distended, if the peristalsis can be seen, if there is any bulge, if there is any mass can be felt. And after that, you will send for some blood investigation, like full blood count, urine stool, abdominal X-ray if it's needed, neuroelectrolyte as well. And then accordingly, you will decide what's the case. So if, for instance, the vomiting was projectile, and while you're examining, you felt a mass, this will denote something called pyloric stenosis. So you will explain to the lady, do you know what's pyloric stenosis? You will just explain always in a slang language, in a non-medical word, so the mother can understand. So you will say, basically, there's a track or there's a tube which connects our mouth to the stomach, and then from the stomach to the small intestine or to the bowel. So you will say that there is connection in there, which could be thickened for whatever reason, and that's why the baby, when he feeds, the food won't go any further beyond that area, and this should be corrected surgically. So basically, you will look for sign and symptom of dehydration. If the baby is dehydrated, you need to correct that. And then, of course, you will arrange for an operation. Another condition which could fall under this category is intussception, which is basically two pieces of colon which invaginate in each other. So basically, it's like inverted socks, whereby they invaginate inside each other. So basically, the baby in this condition, the lady might say that he's crying all the time, he's not feeding. He might pass a stool which is characteristic with something called red jelly stool. So it's like a blood in the stool. That's due to the, of course, to the condition of the invagination. And the baby, he's crying all the time. He has a distinctive cry. And also the stool is loose, and he might have vomiting as well. So when you examine the child or the baby, you will find that he's in complete distress. He's pulling his legs to the chest, which indicate that there is something that doesn't seem right. Of course, the baby will be restless, drowsy. He might be dehydrated. You will examine for the fontanelle. It might be low because of the dehydration. The eyes might be sunken. The nappy may be dry. And after all of that, you will check with the mother as well in this condition, the three main questions, which is about the birth, if he's normal vaginal delivery or cesarean, if he's up to date with his jabs, and what about the development according to the milestone in the red book. Also ask about the feed as well. And then, of course, as pyloric stenosis, you need to send for certain investigation, basically full blood count, urine electrolyte, urine stool, and ultrasound can be used as well, both in pyloric stenosis and intussception, and abdominal X-ray. And the management, you will agree with the mother. You will explain that the baby should be admitted immediately, Nelber os, so he should be fed by IV, and they will try to do something called air enema to help disentangle the two colon. And if it didn't work, they will arrange for surgical correction under general anesthesia or reduce manually. So I hope by this I covered two main cases which overlapping with each other. And don't forget about asking the three main questions in any pediatric case station. Thank you.